hands.
So you've been thinking about this for a long time.
Probably about 2 years.
Yeah. And what was your hesitations? Because you do see so many people coming in and out. Why were you so nervous?
Not so much nervous as a lot of the feedback that I had gotten from patients prior was they were always surprised if I mentioned that I was contemplating that. So I think I had a little false maybe sense of security that I didn't really need it at that point, but I could see.
So what changed?
I looked in the mirror.
Yeah.
Of course, my son is going to be getting married. I felt more comfortable, way more comfortable with the fact of all the results I've seen. All the patients coming in, the quick recovery time, how good they look the day after pretty much. That was the most, I think, shocking. That a lot of people said, oh, they talked through it, they had such a great experience, was not even remotely what they expected. They expected so much more of a long recovery, of a pain, of a bad night, and none of that was true.
So in general, do people say it's painful, not painful, uncomfortable?
People say they're shocked at how easy, for lack of a better word, that the procedure was, and then the aftermath, coming out of the IV sedation. People have told me they played cards that night. They've had friends over. Nothing remotely what I expected when I first came on board and really didn't know much about it.
Suzanne, how'd the surgery go?
Excellent, excellent, excellent.
Yeah. Do you remember any of the surgery?
Not at all.
You were just asleep the whole time?
Asleep.
Okay.
Best sleep I ever had.
Okay. Are you having any pain now?
None.
None? Have you had anything to eat or drink yet?
A few Cheeze-Its.
Okay. So you ready to go home? Yeah?
Mm-hmm.
Get in bed, take it easy. I'll see you tomorrow?
Absolutely.
Okay. So how was your night last night?
Terrific.
Yeah?
Terrific, painless.
No pain?
No pain.
Did you take any medicine?
I took 2 Extra-Strength Tylenol
Uh-huh.
at 3 a.m.
Okay. Did you have anything to eat for dinner?
Toast.
Toast.
Only because tightness, a little tightness, so
Yeah.
I was more conscious about chewing the
Okay.
food than anything else, but no pain at all.
Okay. How'd you sleep?
I was up,
Yeah, everyone's up the whole night
I
because you
was
sleep
up.
all day.
but, I find that with IV sedation, I do stay up for some reason.
Yeah.
I find that, so not anything that I couldn't tolerate, or, it was a terrific night all in all.
Okay. Any questions about things?
Not really. The instructions were excellent.
Okay.
There was.
So you're you have a couple jobs. Okay. Your first job, lift your chin up and down, side to side. The other way. Okay. So that's your job. Is a couple times a day to loosen up your neck. You want to keep it loose. Not.
Okay.
You don't want to stand really stiff. Okay.
Okay.
You can take a shower. You can wash your hair. You probably did already.
I swear I didn't touch it.
Okay.
I swear.
The incisions can get wet, nothing's fragile. For the next 2 days, your activity is daily living. So pretty much anything you can do walking around the house, you can go outside, you can be in the sun. Driving is not great because your neck is going to be tight. See how you feel. Then starting the weekend, you can start picking up your activity level, walking. Nothing more aggressive than a walk or maybe a brisk walk. Nothing with prolonged head down. So no cleaning out closets, anything like that. You can pick things up, but you don't want to spend a long time with your head in a dependent position, okay?
Okay.
And that's pretty much until Monday, and we'll take the stitches out Monday.
Yay. I'm ecstatic.
Good. So how was your weekend?
Excellent.
Yeah?
Excellent.
You look more swollen to me.
I actually am more swollen. I
Yeah.
noticed that. But I attribute it to the lack of elevating my head
Yeah,
on the
so
pillows.
you were sleeping flat?
I was sleeping flat.
Yeah.
Honestly, for the past 3 nights.
Yeah? So you were able to sleep better?
Much better.
But
Much
you're
better.
more swollen?
More swollen.
Yeah. Okay. What'd you do over the weekend, activity-wise?
Walked outside, fresh air, nothing strenuous, no bending forward. Visited, family.
You had friends over?
I visited family and friends just to kind of get out of the house.
Okay. So today we're going to take out your stitches. Okay.
Yeah.
Let me see how you... Okay, you're moving up and down. Side to side. Okay, good. So after we take out the stitches, you can put makeup on anywhere you want. Okay. In terms of activity, you can pretty much do any exercise you want. I would stay away from things like yoga or Pilates where your head is down.
Okay.
I would do elliptical, running, walking, weights in a sitting or standing position. Those things are all okay. Okay. You can eat anything you want. You can drink anything you want. You can pretty much do anything you want at this point.
Wonderful.
Okay. You're going to notice over the next couple of weeks that the swelling's going to come up and down. So you might have one day where you wake up and you're more swollen, and next day you're less swollen, and that's all normal. Okay.
Okay.
Okay. Other things that are going to happen is as the swelling goes down, okay, you're going to start feeling areas in your face that feel a little bit sort of hard, that feel like lumps or bumps, and that's all normal. That's swelling, and that will go away. It'll take a couple of months for all that to go away.
Okay.
Okay. Have you started getting any sensation back? Probably not.
I have gotten a little bit back, actually. I mean, I am numb.
Okay.
You know,
So where are you numb?
I am numb all, right down this side, down this side. I have a total feeling, of course, head, down this way, above the lip, down around the chin. So it's basically from the ear down to the...
And how about your neck?
The neck is a little numb.
Everyone says it's sort of hard and wooden.
It's a little numb, but the range of motion is better.
Good.
Because, a couple times a day I'm moving it around.
So what you're going to start doing is feeling what's called paresthesias, which are going to be funny sensations. So it can feel like bugs crawling on your skin or little electric shocks, and that's the nerves growing back into the skin. And that'll sort of take a couple of months for that to occur. And as that occurs, the sensation will come
I
up.
actually have had that sensation
Little-
already.
little
It's funny you
paresthesias?
say that, yeah. I have had that sensation.
Okay. Other things that can happen is you can be stretching your neck or exercising, and it might feel like something kind of pulls or tears a little bit. There's nothing bad going on there, okay? That's all normal.
Okay.
Okay? Any other questions about what you can or can't do?
No.
No? Okay.
No.
You can go to work today?
Yes, I was here at 8:30.
Okay, good. So we're going to take out the stitches now, and we'll see how you do.
Okay, great.
Okay, so this is where the stitches have all come out, and the incision is healing well. There's one stitch right here, which we leave in, and then the stitches come out here, and then there's a stitch right here that we leave in. And here's the incision. So you're back at work.
1 week post-surgery.
Yeah.
And feeling fine.
Yeah.
Waiting for the last 4 sutures to come out tomorrow morning. Swelling's improved, minimal bruising, and a lot of commentary from patients, actually.
What are people saying to you?
Everybody's commenting on how good my skin looks. Nobody knows that I did the facelift until I actually tell them I did the facelift. But they're commenting on how good my skin looks, how, well I look, so they notice there's a change, but they can't pinpoint it.
Yeah.
Okay. One in the back. I'm ecstatic.
Yeah.
Happy, best thing I ever did.
Yeah.